The other combination of FGFR inhibitor with immune checkpoint inhibitor with a similar design to this study was the NORSE trial, which combined Erdafitinib and Cetrelimab. And the results of that were reported about a year ago at ASCO 2023, I believe. And there, basically the efficacy outcomes seen with that combination are fairly consistent with what we saw here in terms of both response rates. There it was about 55%, but it's within the confidence interval of this study as well. And duration of response, median PFS were also fairly consistent with actually what we see with this combination as well. In terms of future role of FGFR inhibitors, they're certainly right now used following results of the THOR study in treatment refractory metastatic setting. So usually patients with metastatic disease post at least one line of therapy who importantly have FGFR alterations, more notably FGFR3 alterations, so mutations or fusions. And that's the indication for Erdafitinib. But these drugs have been investigated in other settings as well, so in the perioperative setting for muscle invasive disease, but also earlier in the non-muscle invasive disease setting as well. And that potentially may be future role for, I think, those FGFR inhibitors or combinations. Additionally, given, again, the recent landscape shift in urothelial cancer, now that many patients will be getting EV and pembrolizumab frontline in the metastatic setting, or actually patients will be getting immunotherapy based regimens even earlier, probably in the perioperative setting, pending the results of the NIAGARA study that are actually being presented later today. Potentially, we would be looking to test combinations of immune checkpoint inhibitors and FGFR inhibitors in the post-IO treatment setting. I think that's another possibility.